Hey there, New Patient Group Nation. Hope you're all doing great today. And I'm super excited to share with you a clip from a recent webinar event that we hosted from our NPG Innovate monthly webinar series. And this is really relevant for the times. Going to give you a clip from Haley Shaw. Haley Shaw is the digital marketing director at New Patient Group, and just an absolute talent. Super knowledgeable, unbelievable presentation that she provided to New Patient Group clients. And the topic was 3 keys to social media during uncertain times. So in this clip, she's going to give you the first of those 3 essential points and just a little bit of information about NPG Innovate. This is a monthly webinar program that we provide to our clients, as well as anybody that wants to sign up to be part of the NPG Innovate webinar series. And what it essentially provides is just elements out of the NPG playbook. We take a lot of pride in focusing on 3 essential pillars to maximizing a business's success, starting with digital marketing, as you'll hear in this message. Secondly is constant team training. Think about how you innovate internally through team training. And then ultimately, the third pillar is overseeing all of these elements through leadership and accountability. Is how do you and the leaders within your practice make sure that these essential ingredients are being implemented in a very favorable way. To learn more about NPG Innovate, go to newpatientgroup.com/innovate. This is a great way to get to know New Patient Group, appreciate what we're all about, and really get a taste of that playbook that so many of our clients love and compliment as what's helping their business grow at record levels. Additionally, we're running a promotion code where you'll get your first month for free by entering NPG Innovate 2020. Look forward to seeing you there and enjoy this clip on social media success during uncertain times. Take care, everybody. So with that, I'm excited to introduce Haley Shaw Jeffry. Most of you know her very well. She's the director of our digital marketing. And we're just so lucky to have her at New Patient Group. I think if you work with her, you'll appreciate how amazing she is, how thorough she is at her job, how relatable and likable that she is. And just, she really is helping our clients that are doing social media to just create a brand impression that is very, very unique to their dental or orthodontic landscape. We take a lot of pride in doing things very differently than other healthcare social media companies. Really across anything we do, we take a lot of pride in being different in the healthcare space. But Haley does an amazing job of leading our clients to accomplish exactly that. So with that, Haley, I want to turn it over to you. And thanks so much for presenting today.
Thank you. Thank you so much, Eric. That was very kind. I appreciate it. You know, it's so important to me to deliver the best possible experience to you guys so that you can in turn offer that same customer experience to your patients and to future patients. And so that's really what we're talking about today with, you know, the uncertain times that we're facing. Right now, it's the coronavirus. In 3, 4, 5 years, it could be something else. It could be a personal issue that's going on, or staff issues, regardless. Right now, we're looking at the COVID-19 pandemic, and it's putting us all out and putting you out of your practices for at least the next month for most of the conversations that we've had with our clients. And although it's unfortunate, there are a lot of ways you can still connect with your patients and even encourage future patients to get on board. So we're just going to jump right in. And we will stop every once in a while to get some questions from you guys if you have any. So really the first thing we look at with social media is there's so many different platforms that we're able to use. There is, according to Adobe, the most popular from amount of subscribers, amount of users, amount of engagement, time spent on the apps is Instagram first. It's actually really skyrocketed and has grown so much over the last year. Then we look at YouTube, which Google has already said that YouTube is the second largest search engine in the world, and it will quickly overtake Google in the next 2 to 3 years. So video is obviously important. Facebook, a little bit different of a audience because it is people, millennials and up. So there's more, if you have a Facebook, you're aware the different engagement that goes on there, but all the all the business is so important to have on all of these platforms. Twitter is another one. This is mostly actually men over the age of 40. There's a lot of sports discussion. The way that it's set up is different if you're unfamiliar, but also very important. And then TikTok, which is the new rage, and a lot of the kids are doing it, but we're seeing just a skyrocket of engagement on TikTok for older generations as well. And it's really fun, very engaging, and something that the whole family can get involved with. So are you taking advantage of these platforms? That's the real question. And you absolutely have to in order to have this thriving social media presence. And the reason why it's so important is, like Eric said, creating that brand awareness, creating that relationship, and in turn, making it to where these people are going to like, know, and trust you so that they will give you a call. So the first start is now is a great time to start your social media program. If you are been behind a little bit, now is the time to jump on the bandwagon, especially now that you have time at home. So the first key that I really want to dig into, and which is so important, is stay current and stick with the trends. We're talking about uncertain times. So this is all data and content and everything related to where you guys are at right now in healthcare and at home. So the really digging into what does that look like? What does staying current and staying with the trends look like? As you see here, you're a leader in your community. People trust you. People listen to what you have to say. They care about what you have to say. Clinically, they may not know the details, may not know what you're talking about, or what all the brilliant things that you've learned how to do with moving teeth, but they care about you as a person. So they want to see you in front of the camera. They want to be reassured that everything is going to be okay. This is temporary, because there's a lot of chatter and a lot of negativity and nervousness and stressfulness for understandable reasons. But we want to be kind of that harbor for these people on social media. So smiles are definitely something that you have to incorporate in your content, your photos, your videos, and all that jazz. The next thing is sticking with the trends. That's paying attention to what's going on. If you've been skimming Facebook, Instagram, TikTok, there are a lot of different hashtags that are popular. There's a lot of content that you kind of see over and over again, maybe a certain lists that asks you to list what are your last 9 jobs that you did, or what are things that you don't like that most people do. There's things like that, and then along with other popular hashtags that are just trending like crazy. So the real key is to know what that is. As clients of ours for the social media program, we provide you with all of those updated and current trends so that you don't have to do your research. That's what I'm for, and our social media team is for. But that is something that you're able to have access to, so you do know what's going on. And if you check out your April social media assignment, you can see there's a lot of really good creative ideas in there. We'll jump right into it. As far as staying current, this is just a video example from one of our clients, Dr. Skopek, just kind of letting people know what's going on, and not the details of, okay, there's been this many cases confirmed. People know that. They are inundated with it. You really just want to get in there on video and really showcase your personality, reassure them and tell them everything that you're doing in this downtime to help their treatment, produce different aligners or retainers or whatever it is that you're doing, and provide that information. So I'm just going to show you guys this video, and I've incorporated a lot of examples into this because a lot of people seeing it visually will spark their imagination a little bit. So.
Hey guys, Dr. Skopek, and it's the end of the first week of April, and I hope everybody's doing well, staying safe, kind of getting used to this new normal we have. And I'm in the office today, and it may look like a mess because I have Invisalign boxes all over the place, and laptop out, but there's really a method to this madness. What we're doing this week and the subsequent weeks ahead is we're going to get you guys as many Invisalign trays as we possibly can. Anybody that has trays here, or we can just have you pick them up, or we can mail them to you, we're going to do that. So we're taking an inventory of everything we have. We're looking ahead in the schedule, seeing who's scheduled and what we can do to keep you moving. So obviously next week, which will be the week of the 6th, we're closed. We have to be. Expect a call. Anybody that's on the schedule next week, expect a call. Somebody will give you a call in the next few days or so just to touch base, make sure you're doing okay. And again, we're going to get you in, get you going as soon as we possibly can. We're hoping that it goes quicker than people expect, and we're going to play it week to week. So I know you're getting sick of seeing me, but I'm going to send these out at least once a week just to let you know where we're at and how everybody's doing. Again, if you need anything, go to the contact us button on the website or text me directly, 847-989-9716. I appreciate you guys that have done that. We've done a lot of pickups with some retainers, some Invisalign that we can do and that we have. I'll meet people in the parking lot, or people come in, pick them up off the bench outside. It's really worked quite well. So again, feel free to text me. If you just want to text me and tell me you're doing fine, I appreciate that too. And we've had plenty of people just doing that. And again, I love hearing from you guys. We miss seeing you guys, and we'll see you guys again real soon.
So as you can see from that video, engaging, very relaxed, not creating any kind of stress or fear, keeping updated, keeping the patient updated to what's going on. This video was made probably 2 days ago. So it's with what's going on in today's society and all of the very fluid information that we're receiving. And then it's fun. It's, you know, he makes jokes and, you know, he's holding the camera in a selfie style. And that's the thing, is it doesn't have to be perfect. It just needs to be personal. And so the information was presented. It was, you know, 2 minutes and 15 seconds. This can be put on Facebook, Instagram, TV, YouTube. It's able to be put all over the place. But the real point is we're staying current, not scaring anyone, and reminding them that everything's going to be okay and we're all going to get back to normal. So great job, Dr. Skopak. The next thing is, you know, with current content, this is an example from Dr. Barakat. They had the staff, a couple different staff members in there getting shipments from their Invisalign aligners and UPS shipments and breaking them all down and setting up a patient pickup. So that's something that is clinical, but it's current. It's what's going on right now. Their office is obviously closed, but they're still doing the work that they can to take care of the patient and showing them that. So it's just keeping up to date. I have another video, a real quick video here from Dr. Buchholz, where she's in Upper West Side, Manhattan, and she is providing content that's current with what's going on right now, but it's also really encouraging.
The sounds that you're hearing right now are New Yorkers clapping and making noise to honor our brave medical professionals who are working day and night to deal with this corona pandemic. So every day at exactly 7 p.m. for 5 minutes, our whole community, whole New York City is clapping and applauding these brave men and women.
Amazing. Something that's so needed right now, showcasing the encouragement, showcasing the love for the community. Obviously, you guys are all over the country and there are similar things happening everywhere. You want to be the person that's sending out that positive message, and that is exactly what we see with just a quick, you know, 30 second long clip. So great job on that. As far as what you see here on the screen, these are some other examples. We have on the left-hand corner here, Ashley is in the office and she is just getting everything situated and taken care of, emergencies. I know that a lot of times, any regular appointments, all that is shut down, obviously. But with emergency care, you're able to treat them in that way. So it's just keeping them updated. Hey, we're still here for you. We're still aware. We're still here to take care of you. A fun picture from Dr. Ferris. He had all these aligners came in. He's 6 feet tall, so that's a pretty tall stack there. You see this comment here. I first thought those were pizza boxes. So, posting this kind of content that is current but lighthearted. Dr. Weber here, he had set up a care package basically outside the office to offer retainer boxes, new rubber bands, stuff like that. And so that's what this video kind of goes through, and we don't have to watch the whole thing, but just to give you a clue.
Hey, good morning, Weber Orthodontic family. This is Dr. Weber. Just wanted to give you a quick update. We wanted you to know that we care about you and that we're thinking of best ways that we can serve you, make things easy for you. We've been getting some calls about rubber bands, so we've come up with a solution for rubber bands. And what I've done is I've gone ahead and placed a bunch of rubber bands in a couple totes. And what we'll do with those totes is set those outside. We've tried to match every size that we currently use. So all you have to do is come to the office, open one of the totes up and find the size that you or your child is wearing, match it up, and we just ask that you take maybe 1 or 2 packs to get you through. We've also placed some wax in the packages as far as availability, and then some retainer cases in case you have a lost retainer case. Stay healthy, stay safe, and let us know if we can be of any service to you. We're always available on the phones, and we want to be here for you.
So we see showing it off. Yeah. And that's the thing, is that what we look at with all of this, with staying current and being up to date with your patients and letting them know that you're there for them. The truth is, what you do now to survive, although this is very chaotic for everyone, this is the stuff that will make you thrive whenever the storm passes, because you are engaging with your patients, you're reminding them you're there for them, and then future patients, when they're searching it out, they're going to see how you reacted during this time and that you cared and you went above and beyond, and you just can't put a price on that. So great job on that. The next thing we're looking at with trends, sticking with the trends. This is a really fun video done by the Whitlock team as well. And this is what I'm talking about with trending hashtags, topics like that. The C10 Do 10, you guys might have actually seen it, is basically a challenge where you do 10 push-ups and then you challenge a friend or 2 or 3 friends to do the same thing and do a 10 push-ups and keep the challenge going to encourage health while at home. And the truth is, these hashtags are getting a ton of engagements, and on Instagram you can follow hashtags so people will get updated as to when new content comes up. So tying that into the culture, this isn't just something that's great for your patients and future patients to see, but it's so important to build that culture internally as well with your staff. If they're at home, I mean, everyone's at home, and they can do a quick 10 push-ups, they send in a video, we can splice a video together like you're gonna see here. And this is encouraging that relationship internally as well, which is something that Brian and Eric and our training team do so well with, and taking that to that full circle and that step ladder that we see. It's good on all accounts. So
staying inside, but staying healthy. I'm going to challenge you to do your 10 push-ups. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. There you go.
And you'll see here, I'm just going to kind of skip through it a bit. All kinds of different variations of these push-ups. And this is this is something that's fun. This is engaging with the trends. We're able to hashtag and optimize them. Be creative, and that's what we're seeing with something like this, splicing them all together. This is gonna just read so much better than a stock photo or even just a photo of someone doing push-ups. We're able to get them involved, challenge them to do this trend, and then encourage them to tag you. So you're able to tag, check in. There's so many different things on all of these platforms where they're able to get back in touch with you whenever they engage with these things. So that is just a really good example of that. And here's just a couple of fun examples of the trends that we have going on. Like I said, TikTok is taking off in a big way. And we have our new patient group star, Dr. Schaefer, getting into the TikTok game, as you can see here. I think that his daughter was super excited that he finally nailed it. And it was something that, people were absolutely loving. We see 35 people liked it, but 788 people actually were reached and saw this. And then we have, a very good engagement there as well. So we even have people saying, hey, you should do a little bit more of this, make it a competition with mom. And that's what we're able to see, is that while you can video the video on TikTok, you can take a video like this and post it on a platform on Facebook that it's going to read really well. And that's what we see here. This is a video on the outside of what it would take to make a TikTok. This here is a great example of working out at home. That's a really big trend. Super fun. Then we have another here, dancing. And so this, obviously some of these could be silly, they're fun. And this is the staff doing it, but you can do the same thing with your family. If you have any teenagers, middle schoolers, even the younger kids, or kids home from college, this is the kind of stuff that people want to see. They love it. They share the heck out of it. And it ends up being something that's really beneficial for you to get new followers as well. So that is a quick overview of some trending content. So do you guys have any questions? I'd like to open it up real quick on just what that looks like for trending content, hashtags, and staying current. Any questions involving that first key?
So everybody, I've unmuted or given you the option to now unmute. So if you just want to share or ask a question, now would be a good time to do that. One thing I want to recognize is just how great Haley is with her team to turn around content fast. So many of these things that she's showing right now are kind of in the moment powerful, and they do just an amazing job of, if you let them know there's something in the Google Drive and they can pull it out of there and do some quick editing to it or splice it together, as the example you saw a moment ago. They're really good about turning these things around very quickly. Any questions that we can help to answer right now?
Haley, I have a question. It's Debbie here. How often is it, I guess my question is, can posting be too much? Like, what's the right number of doing TikTok videos or Instagram posting or that kind of stuff? Like, how do you know whether it's too much or too little?
Gotcha. Great question. Thank you, Debbie. It's funny you say that. I actually have a slide toward the end about that. And right now what we're seeing, the data is showing that you cannot post too much. If you've ever thought, maybe I'm doing a little bit too much of this, now is not the time. Now is the time to post as frequently as possible, as monotonous and silly as it may be, post it up. And really as a general rule, even before we got into the data with the pandemic, you definitely want to post every day, at least Monday through Friday when doors are open. You can sprinkle in some weekend posts as well that are important. I mean, definitely once a day. If you can do twice a day, that's great. For TikTok, you can do a little bit more, just because the variety is so different. You can do humor, you can do dancing, you can do workouts, a lot of that kind of stuff. So you're able to do a little bit more on TikTok than really all the platforms. You can post on your stories as much as you like. You could post 20 stories in one day and people will just sit there and click right through them and watch them. So right now I would say do as much as possible.
And I would add to that, I think a key word that Haley used was variety. If it were always the same thing over and over, yes, you can create a little bit of where they're getting worn down by your content. But if you create great variety with the unique personalities within your organization and family members as well, people just don't get tired of that. And boy, people are diving into their social media right now as probably more now than they ever have. A lot of time on their hands, right? And so it's just a perfect opportunity.
It is. It is. It's crazy. You guys might have heard about the Mark Zuckerberg issue a couple of years ago, and people were like, "I'm deleting my Facebook," and there was a lot of people that walked away. And reading different data and statistics, it's just surged. There, people are like, "Okay, I had to come back." I mean, they're wanting that human interaction and connection, even if they're not able to engage with it with you in the moment. They feel like they are when they're watching the video. So Eric is absolutely right. Now is time as any.